other speakers who've been there prior to departure. So the retreats, the seminars, the course helps lay the ground for that.
We have a brand new PharmD program. Do you envision that possibly we can have pharmacy students? Pharmaceuticals, I mean, it's hard to get medicines there. As you know, the government has so many different rules and regulations about what you can bring in or buy, or even what you can hand carry. So any thoughts about future pharmacy students?
I don't know if I can speak. I don't know what Cheryl.
So it's their show, but it's funny you asked that because Tim and I were sitting in a little cafe one day. And
I was planted. No,
you were planted. Past me, and like not even looking at me, having a conversation. I'm like, Tim, what are you looking at? And there was a gal in there from CU who is a PharmD student. And so we had a very good conversation with her that we're going to share with Lane soon about their pharmacy program and how CU is implementing it
right,
in
I knew CU
Addis
was doing something.
Yeah. So it could be on the future that they weren't privy to. Yeah.
The experience in general, I mean, being in the healthcare system in Ethiopia, I think would be a very valuable thing for anyone in any healthcare field. So I can't imagine that they wouldn't have an awesome experience and learn a ton either way. But
well, I realize that medicine is, I mean, access is pretty much free, but getting the drugs sometimes is next to impossible. Well, I went back to my village after 35 years and visited the hospital that was, my life, whatever. Just last year, and they were talking about all of the hurdles that they had in getting medicine, and just it was very, very difficult for them. Just medications, just general medications, all the rules and regulations they had to deal with.
Well, I think also just from a medicine perspective, like learning about treating different diseases and chronic illnesses and things like that. I mean, they're going to learn how to treat malaria. Like we don't see malaria. They're going to learn. So I think that, yeah, it would be a good experience for...
Another experience that I had, this is 35 years ago, was the hospitals were the place you went to die. So if you were pregnant and were having a baby and it was, it wasn't being delivered normally, ultimately you went to the hospital and you had a dead baby. And so how did you, did anything change in any of that? Is it still kind of, is there still that fear of going to the hospital? What would you... Any perspective on that?
I think that culturally, a lot of people there won't go to the hospital until they're literally kind of knocking on death's door. Like they're that sick that they need treatment then. So, but I think a lot of changes going on in healthcare over there could help that in the future. I remember we had watched a video in our class about HIV/AIDS patients, and they're paying people to go out to their houses and every day make sure they get their medications. And I think similar things could be done with regards to like prenatal care and birthing in the home. I think that more teaching and just and educating more people there and putting them into these new kind of professions and kind of developing healthcare in that way, I think could make a huge impact. And it seems like they're doing better than we are with like HIV success rates even, so.
A lot of it's age-old traditions, like they will go see the equivalent of a medicine man in their village before they go to the hospital. And some of the treatments that they do for different things is quite scary, but it's tradition and that's the way it's done. So some of it's fighting that, but it's also education, like she's saying, which is really good what they're doing, getting people to the villages and saying, you can be treated. Like the fistulas, is women are sort of scarred for life, but if they get educated and learn about it, then they find themselves in the hospital. So
education is a huge piece. And I think one thing that shocked me was seeing a billboard that says like disability is a reality for me, because in Ethiopia there's just this huge population of disabled individuals, and I was surprised how much they were putting it out there. I feel like a lot of times here we just kind of stick things we don't want to deal with in the corner, and they're much more open with things like that. And so to me that was like a huge education piece. Like, there's tons of people who are disabled. What are we going to do about it? How are we going to fix this problem? And so I think just in general, as long as it's out there and people are discussing it, that as long as you can increase the education, then people will get in and get care. So.
Can I just make one real quick plug? In regards to pharmacy participation, Lane and I have talked about this for some time, since he's been here, about eventually involving pharmacy in these programs. And I think what's beautiful about this program is that PT has been able to go and sort of with nursing what they just say, but still at the same time identify some of their own objectives and some of their own approach to their time and what they have to offer in Ethiopia. And I think the same approach is going to be good for pharmacy when we talk about this next year having the faculty come. And we can surely introduce them to our partners and provide everything that we have in the way of relationships, but also it's going to be upon pharmacy to decide what is the avenue, what's the best approach to get involved in Ethiopia. So I'm excited for when we get to that point next year.
And I think that's the biggest thing is maintaining the relationships, because really some of the people we have there are, I guess we'd say they're our friends. They're friends of Cheryl. They've had a relationship for several years, and each time we can be a little bit more efficient in how we spend our time helping people and learning and making more associations. So that's a really big piece.
Susan, do you have a question?
No, I just had a comment. Until I read the novel Cutting for Stone, I did not know what a fistula was. So would you be so kind to explain to some people that may not know what it is?
We thought about mentioning that earlier. So what a fistula is a lot of times in Ethiopia, the women give birth in their village, and their villages are very rural. So whoever may be helping them give birth might just be what they term a midwife or a woman in the village who's helping, and she may not be educated at all. All she's educated to do is help the woman through it and help her give birth. If something goes wrong, a lot of times the baby actually dies in the womb. And the woman may have the baby inside her for up to 10 days. And this whole time the baby is pushing on organs, in this case the wall of the uterus. And that eventually makes the uterus rot, and there's a hole. Okay, so then the baby eventually comes out, but now there's a hole between the uterus, or between the vagina really and the bladder. So now whenever the woman creates liquid in her bladder, it just leaks out. And it leaks down her leg, and this is considered a very shameful thing in Ethiopia. If this happens, you're sick, you're shunned. You're put away in the village, and you have to live in a hut, sort of in the back of the community. And no one talks to you, you can't integrate into life. So these women really want to die, and that's what the movie's about. A lot of these women, they don't know what's wrong with them. They think they're ill, and they think there's nothing left to do but curl up in a ball. But then the movie is about educating these women, saying, look, there's hope. You can go to this hospital where they fix your fistula. They actually sew it back up. And then pelvic floor therapy, which physiotherapists do, help strengthen it. And then they can go back to their village. It's like a new life for them. So that's really what a fistula is. And we didn't get the chance to treat the women, but we got a chance to go to the hospital and see these people who started the program. So I'd recommend watching the movie. It's pretty powerful.
We also got to see the physical therapy department there and some of the treatments they were doing. And we tried to start making some connections so that maybe in the future we could have an association with them. And also they're looking for volunteers for longer term. So that's an idea for some of us if we want to go back to Ethiopia and have further experiences there. If we were to stay for a year, then we could be a physical therapist at this hospital and really make a difference in their care. So.
I think Noel would like to...
I'd like to add a few things, as I always do. First of all, how do you feel about your school? That you've had this opportunity, as opposed to going to Metro or somewhere else where you wouldn't have it. It's a loaded question for the faculty.
We like it.
Yeah, I heard about it before I actually applied here. And so that was actually a part of the reason why I came to Regis, is because of their service mission and the ability to go.
Of a true commitment to social justice.
Exactly.
You're absolutely right.
Just trying to make sure we keep this program. Here's my next 2 cents. It has always been my dream that there would be a connection between a Jesuit university and Mother Teresa. And I'm really happy that you guys broke the ice this year. What I would encourage you to do is develop a fabulous relationship with Dr. Rick, which in turn will open the door for both sides, the physical therapy side, which is an incredible need, and then for you guys to be assistants for Dr. Rick on future trips. Dr. Rick will be here in October, and we are established on something quite profound to support him. And I would encourage you to really see what this man is about.